Well, good day, everybody. My name is Laurie Proulx. I'm a patient partner involved in research and a number of different things. I live with juvenile rheumatoid arthritis, something I was diagnosed with when I was 14. And I'm also a part time managing director for the Canadian Arthritis Patient Alliance, which is a grassroots patient organization. And I was involved in this project that I'll be talking about today with Linda Roy.
Hi, my name is Linda Roy, and I was diagnosed 30 years ago with rheumatoid arthritis at the age of 34. I am extremely honored to participate in this grassroots training initiative. And I'm also a person with a disability and belong to the New Brunswick Coalition of Persons with Disabilities.
Yeah, thanks so much, Linda. And here are our disclosures in terms of this project and some of the work that we do. So in terms of, a little bit, I guess, about this project. And so this was really a training program to better support patient partners involved in research. So I'm sure many of us have heard about the Strategy for Patient-Oriented Research, which is a CIHR, Canadian Institutes of Health Research, initiative where patients are involved in planning and designing research projects and bring their lived experience to the forefront. And so, many people involved with CAPA, or the Canadian Arthritis Patient Alliance, are also involved as patient partners in research. But we've been finding that there's been an increasing demand for patient partners. And we thought it was a good idea to sort of grow our network so, we could expand the community of patient partners, but not just expand them and, ensure that there is different representation of patient partners, but do so in a way that equips them to get involved and carry out the role. We know that there are sometimes barriers to being involved, and often knowledge and health literacy are critical points or parts of that. And it's important to remember too that patient partners, we live with various forms of arthritis, but we come from a range of backgrounds. It's not necessarily based on research. We also do a lot of peer support. We do a lot of education. So to offer some sort of training program, it seemed like a solution that was a logical extension to what we already did, because we develop a lot of resources. We offer a lot of education by and for the community. So it seemed like a logical add-on. In terms of the team, the slide basically describes who was involved in our project. And so there's myself and Linda Roy. There were, 5 additional participants because Linda was involved as, a participant in this training program, as well as board members with CAPA that acted as mentors for the project. And so with that, I'll pass it over to you, Linda.
During the recruitment phase, I was introduced to Linda Willem and Laurie Proulx of CAPA, who offered me this opportunity, in which I was able to share my lived experiences as a person with arthritis. The training was an online platform, which was easily navigated and consisted of modules that we could complete at our own pace, which for people with arthritis is very important, since we have good and bad days, and this gave us the flexibility to complete on our own schedules. I found that working in a research group for patient partners will be important for the future of arthritis research, since each of us have our individual lived experiences. Having a business degree along with work experience in research and development in an agricultural chemical company helped me prepare and understand the process much better. The training program allowed our mentors and facilitators to offer a variety of opportunities to each of us who participated, which gave the researchers a wider variety of information.
Yeah, thanks so much, Linda. And so, I mean, for us, I mean, she brings to life, I guess, what the phases of the training program involved. Um, but kind of from my perspective, we sent out a recruitment notice, shared it with our network, of which Linda was luckily one of the applicants, and so we had 6 people that were interested. I think there was an additional one that didn't follow up, but nonetheless, we met them one on one. We set up a time to convene as a group and orient people to what the training program was going to look like, but also it provided an opportunity to get to know each other as people, because one of the things that we were hoping to also kind of create through this is just sort of an informal network of people that you can kind of go to when you do have questions, when you're unsure what to do. We know people can go to researchers, but we do really think that there's a value to that peer support, because we've been involved in these research projects. We know how it can feel, and it can feel uncomfortable even at times. We also created a community on a software tool called Basecamp, which is a private community just for the group, where people can, interact with each other online like that. And we tried to set timelines that were flexible for people, recognizing that, first of all, we all live with arthritis, and we know that goes up and it can go down, and we never know sometimes from one day to the next. So we did want to provide some flexibility to sort of adapt to people. And then the training, the formal part of the training program included, as Linda mentioned, completing 4 virtual modules. These were developed by the Institute of Musculoskeletal Health and Arthritis, through their patient engagement and research ambassador group, who were involved in that. So they took that online program, which took about, I think, 3 to 4 hours to complete. And then it kind of was left to me, I guess, as someone who was facilitating the group, to match people to opportunities as they came up. And so often I tried to match people to things that were of interest to them, because I have gotten to know people and I have engaged with the group. Or sometimes I just kind of put out opportunities to the group, and then they can express interest and follow up on their own. And then, of course, we did some evaluation efforts that were a little more formal, we consulted with the group to make sure that we were asking the right sorts of questions, and then administered that through a survey with everybody. So roughly speaking, these are the different elements of the program. So in terms of some of the impacts of the program, I mean, for CAPA as an organization, I mean, it really increased our capacity to, match patient partners to these different opportunities. We have 6 patient partners that were recruited. We also created like a broader network with our 5 mentors, to kind of bring together that overall group. And we ended up matching people, I think, to a total of 32 opportunities, at least going up until the end of last year, of which I think 18 or so were research projects. But we also used the opportunity to engage these individuals in different CAPA activities as well, like whether it be attending our strategic planning session or getting involved in webinars and these sorts of things. So kind of bringing them into different aspects of the organization. So, and then I'll pass it over to you, Linda.
Oh, thank you. The word impact came to mind, and how it will attribute to the future success of our efforts as patient partners, and how future research will be affected. The future of how patients are cared for and advocating for ourselves, and the integration of shared decision making between patients and their doctors and other health professionals will impact the future as a whole. Now, the technology that we used for the platform was very well managed. The learning modules, as Laurie stated, I believe there was 4 of them. And the training platform offered the information and the learning modules. Communication could have been better organized at times. As a group, we could discuss the shortfalls and struggles as we proceeded through the training.
Yeah, for sure. Thanks, Linda. And in terms of like just some of the more formal evaluation results, I think Linda really brings to life some of her experience here. You know, 2/3 of patient partners at the end of the program felt prepared to be part of research teams. And while that does seem positive overall, I mean, I still think, you know, 1/3 also felt that they needed more, and more training, more knowledge, so that they feel equipped to kind of go into these environments. And also there was some comments about, you know, perhaps having a bit more time to complete the modules. To sort of fit with their life. But in terms of, you know, more specifically looking at, you know, more training, that is a future direction and a project that we're working on as an organization. Linda's also involved in that project. So again, another example of bringing people along and into other things. So we are looking to develop sort of the next level of training, kind of pulling it all together. And we've involved the group in trying to figure out what that's going to look like, and what they would like to learn, so they feel more equipped for these things, as well as, you know, exploring collaborations. And this additional training program is a collaboration with the Ottawa Hospital Research Institute. And I think it's just a good example of how researchers and patient partners or patient organizations can kind of work side by side to address some of these gaps.
Now, for me, the patient partners getting involved in other groups was extremely important. And I myself had belonged to a group that where there was orthopedic surgeons, researchers, and patient partners. And just to see the integration of the three groups, and how when someone has knee replacement surgery, for instance, and how they feel, the orthopedic surgeons, how they feel, like everybody as a group feel about when the surgeries are done, and the struggles that each group have. And having this communication made it so much easier, and you could understand how the other person, in the researchers and the orthopedic surgeons, felt as far as the way the surgery went. And having this was very important for me because of my surgeries that I've had in my past.
Yeah. No, thanks so much, Linda. And I think it just highlights the value of sort of engaging diverse perspectives together in research, and hope that you might all consider involving patient partners in your work, and feel free to sort of reach out to us, if you wish to do so, because we have a group of people who are very interested in participating. So thank you very much.
And thank you.